Hi, my name's Abby. I'm a therapist and a wellbeing practitioner. I wanted to share a technique today called diaphragmatic breathing, which is a breathing technique that I teach a lot of my clients, and I always get really good feedback from it. I also use it a lot myself in certain situations, and I always find that it helps me. So this is a technique called diaphragmatic breathing, which is a breathing technique that we can use when we're feeling stressed, anxious, overwhelmed, panicky, any of those kind of feelings. And what it does is it can bring us from a stressed state of being to a more relaxed state of being. So when we're faced with any kind of situation that we find psychologically challenging, what happens is our body goes into a state of fight or flight. Now, lots and lots of things happen in the body and the brain when we're in fight or flight. So, for example, the heart rate increases, the digestion ceases, we get a surge of adrenaline, we might feel tingly or shaky in the hands and the legs, which is the blood racing from the extremities to the major organs. Lots of things happen in the brain as well. So we're probably all familiar with that moment when maybe we've just sat down for an exam and we get that blank feeling. That is because we're in a state of fight or flight. And what happens is the prefrontal cortex, so the memory, logic, reasoning part of the brain, that goes weak, and the lower part of the brain, the amygdala and the hippocampus, that becomes strong, because when we're in a state of fight or flight, we don't need memory, we don't need logic, we only need to survive. So that's why we have that moment of blank. Now, going into fight or flight can be, and really was, a really useful thing. So back when we were cave people, we were often faced with physically threatening situations. So, for example, a threat from a predator, a threat from another tribe. So it was a really good thing that the body and the brain could go into this state very, very quickly. Now, we don't often find ourselves fighting lions these days. We're normally faced with more psychological challenges like exams, driving tests, presentations at work, first dates, and now that's when the body goes into fight or flight. And we know in those kind of situations that being in fight or flight is not helpful. We're all really familiar with that feeling of having butterflies in the stomach and that really panicky feeling. And what it does actually is it distracts us from what we want to be able to do. So it's really useful to be able to have techniques that can take us from fight or flight to rest and digest. Or, in the more technical terms, from sympathetic nervous system to parasympathetic nervous system. So breathing is a really good way to be able to activate the parasympathetic nervous system to get ourselves into rest and digest, and especially diaphragmatic breathing. So there are a few things that are important with diaphragmatic breathing. Firstly, we want the out breath to be longer than the in breath. This is because when we're in fight or flight, we take in excess oxygen in order to make the muscles stronger and for the brain to be hypervigilant. So when we're coming back to rest and digest, we just want to let go of that excess oxygen and have a healthy exchange of oxygen and carbon dioxide. We want to be able to breathe in through the nose and out through the mouth, so we've got a really long, full out breath. We also want the diaphragmatic aspect of the breathing. So the diaphragm is a dome-shaped piece of muscle that sits below the rib cage. And when we take a nice full breath into the whole of the chest cavity, the diaphragm has to move down to make space for it. And then what happens is basically the stomach gets squashed by the diaphragm. So the diaphragm moves down, the stomach gets squashed, and it comes out, it protrudes. Really, in the same way that if you put air into a balloon, the balloon will expand, and then when we let it go, the balloon will get smaller. I can't think of the opposite word to expand. But yeah, air goes in and it becomes bigger, air goes out and it becomes smaller again. That's exactly what's happening with the belly, essentially. So we want that diaphragmatic aspect. We want the diaphragm to move down and the belly to expand. We also want the body to be as relaxed as possible, which kind of sounds counterintuitive because we know we're going to be in a state of anxiety. But if we can control the body and almost force ourselves to relax, then it begins to switch the brain back on, and be able to bring back a bit more control to the brain and to the body. So we want to physically relax the body, and I'll talk you through how to do that. But first of all, let's just do a couple of rounds of breathing, just for you to observe what it's like for yourself when you're taking deep breaths. So I'd suggest you pop one hand on your chest and one hand on your stomach. And on the count of 3, we'll take a nice deep breath in. So 1, 2, 3, breathing in. And breathing out. Breathing in. And out. Okay. So what was that like for you? Did you notice any movement in the body? Did you notice the stomach rising or falling? How did it feel to really focus on the breath? Now, for a lot of people, when we say take a deep breath, what we see is their chest really move, or their shoulders really move, or you know, their whole body moving up and down, looking something like this, which is fine. It's not dangerous in any way. It's just not the most relaxed breath we can take. So what we want to be able to do is just relax the shoulders and relax the chest and neck area. So as long as you haven't got any shoulder injuries or neck injuries, I'd suggest you just do a few shoulder rolls. So pop your hands on your shoulders and just roll the shoulders out. And you might feel some clicking or some popping. That's fine. It might be a sign of tension or just the muscles shifting. So do a few shoulder rolls. You can do this for longer if you've got time, but just for the purpose of the video, we'll just do it a few times. Okay, and then just shake your arms and hands out. And then maybe lift your shoulders, drop them down, lift them up, drop them down. So we're really consciously relaxing the chest, shoulders and neck. Another thing is that people can find it quite difficult to get the breath into the belly, to do the belly breathing. And we find that, yeah, like the breath just in the chest and they don't feel any movement in the belly. Now, very often we walk around with good posture and we kind of almost trained by society to hold in our stomach and to be standing up tall, which is great. It's fantastic in lots of ways. But in this breathing, we want the belly to feel fully relaxed, and we don't want to be holding in or constricting anything. So it might be helpful to pop 2 hands on the belly and just become aware of the belly, and we're going to encourage it to relax. So encourage you to let your posture go, basically, in the stomach area. So first of all, just pull your stomach in like you're putting on a small pair of jeans, and then let it go, push it out. Pull it in, and then let it go, relax, push it out. One more time, pull it in, and then relax it, push it out. So that's just encouraging some relaxation in the belly, encouraging you to not hold the stomach in, but just let it be as relaxed as possible. So now we're going to go with a few rounds of breathing again. So as I said earlier, we want the out breath to be longer than the in breath. Some people do 7-11 breathing, which is a really useful number to remember, 7-11. I find that a little bit too long for me, so I do 4-2-6 breathing. So we breathe in for 4, we hold for 2, and we breathe out for 6. Don't you worry about that. I'll do the counting and talk you through some prompts to encourage the belly breathing. So you just follow the voice and follow my guidance. So let's again put one hand on the chest and one hand on the belly. And on the count of 3, we'll breathe in. So 1, 2, 3, breathing in. Breathing out through the mouth. Breathing in through the nose. Breathing out, let the shoulders relax, the neck relax. Breathing in. Breathing out, just feel comfortable in your seat. Let the arms relax. Breathing in and let the belly expand. Breathing all the way out. Really empty the lungs. All the way out. Breathing in. Breathing out and let the belly relax. All the way out. Breathing in, let the belly rise. Breathing out, let the whole body relax. Let's bring in some counting. So breathing in, 2, 3, 4, hold, and out, 2, 3, 4, 5, 6. Breathing in, 2, 3, 4, hold, and breathe out, 2, 3, 4, 5, 6. Breathing in, hold, breathe out, 2, 3, 4, 5, 6. Breathing in through the nose, let the belly expand. Hold, breathing out, let the belly relax. All the way out. One more time, breathing in. Hold, and breathing all the way out. Okay, great. I hope that felt okay for you. Some people say they feel a little bit dizzy after they've done that kind of breathing, which is normal. It's absolutely fine. Don't rush to stand up, maybe have a sip of water. Obviously, if that dizziness continues, then take your time, and you can always get in touch with your GP. But the dizziness is normally there for a second, and then it everything feels fine again. It can be difficult, diaphragmatic breathing. So lots of people find that they can't feel the belly rising and falling at the beginning. That's completely normal, it's completely natural. Diaphragmatic breathing is the way that we naturally breathe when we're babies. So if you hold a baby, you'll notice it's their stomach that rises and falls when they're breathing. But in the same way that we lose our natural flexibility very often when we grow, we lose that natural ability to breathe diaphragmatically. So don't worry too much don't worry at all if you don't get it first time round. Keep practicing. The more you practice, the lower your stress levels will become, and the easier it will feel, and it will become very natural to you, and you'll be able to shift into diaphragmatic breathing very easily and very quickly. If you're struggling with it, you can also try lying down and popping 2 hands on the stomach, or even a book on the stomach, and trying to lift, let the book rise and fall. That can be a really useful thing to do. But honestly, just keep practicing with it. Practice it maybe a few times a day when you remember. So maybe when you're waiting for the kettle to boil, or toast to cook, or when you're waiting for an appointment to start. Any kind of spare moments that you get in the day, practice that kind of breathing. Also practice it in a more meditative way. So you can pop your timer on your clock for 3 minutes, 5 minutes, 10 minutes, whatever feels good for you, and really practice and concentrate on the breathing technique. It can be really good to practice at bedtime when you're trying to go to sleep, especially if you're somebody who worries a lot. If you worry at night time, then very often we can't get into that parasympathetic state. We can't get the body into rest and digest. So doing this breathing will really help you switch off. It will also distract you from those worry-based thoughts. So really good to practice at night time when you're going to sleep. And the key is practice, practice, practice. Very often with lots of well-being techniques, they don't come naturally. It's not something that we've done before, or we've done for a long time. So practice it. If you want a shortcut to rest and digest, what you can do is just take a deep breath and a long breath out. Just one breath with the focus on the out breath. Or a really effective thing to do is sigh. So just, and that's almost a shortcut to rest and digest. I would encourage you to practice diaphragmatic breathing still, but it's just maybe if you've got something this afternoon or you think I just can't get the breathing, just sigh it out, and that will help you rebalance and come back to a more restful state of being. So I really hope you find that useful. Practice, practice, practice. Good luck and take care.